Hello, today we're going to draw the branching of the iliac arteries, and to do that we're going to start by looking at the bones, bony landmarks, and the organs of the pelvis to see how those arteries relate. So we're going to start by drawing in an ilium. We've got the iliac crest, anterior superior iliac spine, anterior inferior iliac spine, moving on to the pubic bone here, little pubic tubercle, and our pubic symphysis. So we're looking at the hip bone from the medial side, and right here, extending inferior from the pubis, we've got the inferior pubic ramus going to the ischium. Then we have our ischial tuberosity, nice big bump there. Then a little spike sticking up, that's the ischial spine, as the ischium fuses with the ilium up here. Now here, I'm going to draw in the superior part of the pubic bone, and also draw in a bit of an obturator foramen. So we've got the obturator foramen going right here between the ischium, right here, the pubic bone here, and here. Now up here we're going to draw in the sacrum. We'll start by drawing in S1 and then the rest of the sacrum pointing inferiorly from there. And I'm going to draw this as though we're right on the midline. So we've cut through the sacral or vertebral canal, and here we're just going to put our spinous processes, which are fused into a median sacral crest right here. And that's going to be our midline sacrum, and then just complete our ilium right there. So here's our bones that we're going to start with. But before we move any further, I want to put a couple ligaments in place. And the first one is extending from the ischial spine to the sacrum. This is the sacrospinous ligament right there. So sacrospinous ligament is this guy. And one thing I should do before I go any further is subdivide the sacrum so that we've got the first, second, third, fourth, and fifth bodies there. Now these are usually fused. There may be a little bit of an intervertebral disc between S1 and S2, but they quickly dwindle. But you can still make out those distinctly. And at the very end of the sacrum, we're going to have maybe about 4 coccygeal vertebrae, very small guys right there. We have the sacrospinous ligament going from the ischial spine to the sacrum, and we've got the sacrotuberous ligament traveling from the ischial tuberosity right here off to the sacrum and coccyx as well. So we have these 2 ligaments also in plane of view. I'll just outline them a little bit to make them distinct. Happy day. So here's roughly what we're going to start with. To see how the organs of the pelvis are anchored by muscular structures, we're first going to draw in a muscle that's going from this entire area. So I'm going to cover over. I'm not getting rid of this as much as I'm trying to cover it with a muscle that pretty much covers the entire inferior inner surface of the pelvis's wall. It's medial wall there. And this is the obturator internus muscle. So we're going to draw in its muscle fibers right here. Its tendon is exiting through the inferior sciatic foramen right there. So here's a muscle, and it's really kind of stuck to the lateral wall of the pelvis. Other muscles we're going to draw in a minute are coming out from it in 3D. They'd be coming out of the screen, but here, this one is relatively stuck to the wall there. Now the first muscle I'm going to draw that's extending outward is called the coccygeus muscle, and it forms the first part of the pelvic diaphragm. It's coming from the ischial spine, and it's inserting onto the inferior sacrum and coccyx. So here, I'm going to start by outlining roughly where I'm going to put that muscle. And it's a little bit more medial than these ligaments, so it's not really in the same plane as them, although with a two-dimensional drawing it might look a little bit that way. Alright, tidy that up just a little and add some muscle fibers. So this is our coccygeus muscle. And just fun fact, this is the muscle that dogs use to wag their tail, going from the ischial spine up to the base of the tail, or in humans, the vestigial coccyx. And the rest of the muscle that forms the pelvic diaphragm is going to be going from here all the way across to the ilium and the pubic bone. And it's going to originate from the lateral wall of the pelvis And in so doing, it actually has to originate partially from the fascia of the obturator internus muscle. So the thick fascia that covers this muscle actually gives rise to some other muscles. So since they cover the obturator internus, I'm actually going to erase a bit of it, and just remember these muscles are coming out of the screen. The first one, I'm going to outline here in black, is coming from the pubic bone and the pubic region of the obturator internus muscle. And this muscle goes out and then cuts back around here, and it surrounds the rectum as it is exiting the body. So the rectum is coming down. This would loop back up to the opposite side from the right pelvis to the left pelvis. So this first part is going to be called the puborectalis muscle, because it is going from the pubic bone around the rectum. And it is skeletal muscle, so I'm going to draw it in here with some nice little red lines. And it is the first part of the levator ani muscle, so named because it lifts the anus upward when it contracts. The next part is also coming from the pubic bone and pubic region of the obturator internus fascia, but it makes it all the way to the coccyx, and it is going to be called instead of puborectalis, it will be the pubococcygeus muscle. So we'll draw it in right here, and then continuous with it is another region called the iliococcygeus, which is coming from a tiny bit of the ilium up here. I'll draw that a little bit higher just to make that nomenclature make sense, and it's coming to the coccyx as well. And so the three portions of the levator ani muscle are the puborectalis, pubococcygeus, iliococcygeus, and then that levator ani muscle, its three parts, are somewhat confluent with the coccygeus muscle here, also sometimes called the ischiococcygeus, and they form the pelvic diaphragm. And in reality, these would be coming out of the screen. They form a funnel with the rectum traveling through, and when they contract, they help elevate and lift the rectum, hence levator ani, lifter of the anus. So these are the muscles and other structures that are supporting all of the pelvic viscera. And we're now going to add some of those. So if we're going to cover the blood supply, we actually need to understand some of what the organs are that are getting blood. So in males and females, we're going to have a rectum coming down from the sigmoid colon. Rectum comes down, and it's going to pass through levator ani right there. And we'll just get rid of the other structures here because the rectum is passing medial to them, so it's passing in front of our view. So bye-bye all those guys. So right here's the rectum. It's going to pass down to the anus, which is just below here, some skeletal muscle around it. That'd be the external anal sphincter. We'll just kind of draw that in for fun right there. And for any Kurt Vonnegut fans, here's the anus as asterisks right there. Okay, so now we've got the rectum in place. Whoops, wrong color. Bear with me. Next up, if we are female, we're going to have the vagina and uterus. And here, I'm just going to draw those in this area right here. So we'll have the vaginal wall coming up. Then here, the vagina meets the uterus at the cervix. So we're going to draw the cervix in. And the uterus can have a variety of appearances, but we're just going to draw it anteroverted and kind of hanging out anteriorly right there. So we've got the cervical canal right there, and a little bit more open as we get into the uterus right there. So here's the rectum. Then we've got our vaginal wall, relatively thin compared to the thicker wall of the cervix. And then uterus. The uterine lumen's a little bit extreme. It's not quite that open in someone who is not carrying a child, but get the idea that it is a lumen and space inside there. So that's the vagina, and last but not least, we have another organ right out here. That's going to be the urinary bladder. So we'll draw in our urethra In females, it's going to be relatively short structure, shorter than that. And then we'll draw the urinary bladder in right here, with the uterus right on top of it there. Then we'll just get rid of, the finger actually works better than the paper towel. Get rid of all the stuff that it's covering. Those muscles are still present, but they're lateral to the view we're getting now as we build inward. And there is our urinary bladder right there. Now, if we have a female, we're going to have the vaginal opening and external urethra meet in the vestibule. So common chamber for those right here. The skin would be going upward and backward there. So vestibule, vaginal opening, external urethral opening. If we have a male, we don't have the vagina and uterus. Instead, we have a different set of internal genitalia. Now the bladder is still present, so we'll keep the bladder. It's right there. The urethra is going to come down, enter the corpus spongiosum of the penis, and then head outward through the penis. It's going to extend that way. But here, we're just going to draw the rectum in there, and at the base of the rectum we have, not the base of the rectum, pardon me, base of the bladder, we've got the prostate gland. So in males we have a prostate gland sitting right there. Extending off of it are the ductus deferens, which is heading out that way, and the seminal vesicles just inferior to the ductus deferens, and they're going to drain through the ejaculatory duct into the prostatic urethra right there. Alright, so I think we've got all the players now for both male and female pelvic anatomy. Now let's discuss how the blood vessels to this area are actually formed and how they get blood to those various organs. Now, I've drawn the bones in here to give us a little sense of the architecture that we're going to follow as we go through the vessels themselves. And right here we've got our obturator foramen right here, and I'm immediately going to wipe that out and draw in the obturator internus muscle. Just to remind you that it is covering a hole in the bone, and that'll come into play, maybe a little more important in just a bit here. But next thing is to draw in this obturator internus muscle arising from the obturator foramen and sending its tendon out the lesser sciatic notch right here to affect the upper limb. Also in the area we've got off the sacrospinous, we have the sacrospinous ligament coming off the ischial spine right here. So that's going to be fanning out to the sacrum. It's not quite this long in reality. I've expanded it a little bit just for ease of drawing. And then the sacrotuberous ligament, also in the area, going between the ischial tuberosity and the sacrum. So we've got those two ligaments helping define some of the boundaries in this area. And those ligaments being present create the greater sciatic foramen and the lesser sciatic foramen right here. Nice landmarks that we'll need in just a little bit. So to draw the vessels, we're going to start with the major branches of the aorta that are descending into the pelvis. The aorta splits and forms two common iliac arteries, one on the left and one on the right. And so here we'll draw in our common iliac artery descending into the pelvis, and the common iliac is going to split into an external and an internal iliac artery. So the external is going to head out this way, and it's going to pass into the anterior thigh to become the femoral artery. We'll see that in just a minute here. Inside the pelvis, the external doesn't have many branches. It gives off one branch to the nearby iliacus muscle. This is the deep circumflex iliac artery. And just before it passes out of the pelvic cavity, in the abdominal pelvic cavity, it gives off a really large branch that runs on the posterior side of the anterior body wall. This is the inferior epigastric artery. And it's the last usual branch we're going to have coming off of this vessel in the pelvis. Thereafter, it passes through the inguinal ligament, which is the inferiormost portion of the external abdominal oblique. And once it passes through that ligament, it becomes the femoral artery. Now the femoral artery is going to give off a couple other branches, very proximally, the superficial circumflex iliac, so the counterpart of the deep circumflex iliac here, and one that's going to the anterior portion of the external genitalia. This is the external pudendal artery, and we'll see its counterpart in just a little bit. Thereafter, we have the femoral artery and all of its branches in the lower limb and thigh. Now take a little break and draw this in, color it in red for artery. Now that we've got it all colored in, let's review. Common iliac artery splits into the internal iliac, more on it in a second. The external iliac artery. Off the external iliac, we get the deep circumflex iliac artery, the inferior epigastric artery. We pass through the inguinal ligament, become the femoral artery, which gives off the nearby superficial circumflex iliac and external pudendal arteries before continuing as the femoral artery. Now, we're going to turn our attention to the unfortunately far more complicated branching of arteries that's going on over here. First off, the internal iliac artery has two divisions of its own, a posterior division and an anterior division. So posteriorly, we have three branches, one that heads up between the sacrum, the ilium, and the lumbar arteries, lumbar vertebra, pardon me. So the ilium out here laterally, sacrum and lumbar vertebra a little more superiorly there. And this guy goes by the name the iliolumbar artery. So iliolumbar is right there. Try to make it as distinct as I can. Then we have one that goes along the lateral aspect of the sacrum all the way down, supplying structures near there and also giving off branches into the sacral canal to supply the nerve roots that are there. And last is the big one. We have a great big superior gluteal artery coming off the posterior division of the internal iliac artery. So this guy is the big one off this branch. So superior gluteal is exiting through the greater sciatic foramen. It actually squeezes out on the superior side of the piriformis muscle, which would be lying right about here if we had it in place. Now we're going to fill in these branches of the posterior division of the internal iliac artery. Alright, and once again, posterior division of the internal iliac artery gives off the iliolumbar, lateral sacral, and superior gluteal arteries. Now, the anterior division is a lot of fun. So here, let's start with two of the branches that come off anteriorly. First off, we have a branch that's going to come off, loop inferiorly. Make a little room there, sorry about that. Loop inferiorly, give off several branches that go to the urinary bladder. And then, this artery does an amazing thing. It actually continues up the anterior body wall, still on the inside, but runs mostly parallel to the inferior epigastric artery that we saw coming off the external iliac. So it's going to run parallel to that. It's actually going to head out the umbilicus. And because of that, this is the umbilical artery. This is the artery that carried blood from fetal circulation into the umbilical cord and then to the placenta so that our mother's blood could actually give it some oxygen, take away waste products, and so forth. There are umbilical veins in other places of the body, but we're not going to worry about those. So during embryonic life, this is a super important vessel because it carried blood from us to the placenta and kept us alive. However, once we're born, the placenta is no longer functioning. The cord gets clamped, and all of this artery, on the anterior body wall becomes fibrous. And the fold that's still visible covering this artery is called the medial umbilical fold. And no big surprise, the fold of peritoneum covering the lateral, more side here, the lateral umbilical fold is covering the inferior epigastric artery. So we got fibrous all the way back right until we get to here. These little branches are supplying the superior part of the urinary bladder. And because the urinary bladder is still working and still needs blood, these branches stay open. These are called superior vesical arteries accordingly. So the umbilical artery is this structure here. And off of the umbilical artery we have multiple, there's usually more than 3, but I'm only drawing in 3 for ease of work here, superior vesical arteries. Now next up we have a branch that's going to exit the inferior, it's going to exit inferior to the umbilical artery, but actually run even more anteriorly and exit a small little gap in the obturator internus muscle, and thereafter pass through the big hole out here, the obturator foramen. This vessel is going to pass through the obturator internus muscle, through the obturator canal, through the bony defect, or the bony opening, the obturator foramen, and it's going to supply the muscles of the medial thigh. This guy, or gal, depending, is the obturator artery. So our first 2 branches off the internal iliac's anterior division are the umbilical, giving off superior vesical, and obturator arteries. Now, if that wasn't fun, wait till you see what we got coming next. The further branches of the anterior division of the internal iliac artery are going to be coming here. And we've got an area where multiple branches may arise, and I'm going to draw in 3 for the moment. The first is going to pass forward and around towards the rectum, and this is going to be the middle rectal artery. Another branch is going to pass posteriorly and out through the greater sciatic foramen, and it's going to travel inferior to the piriformis muscle, which again would be laying right here. This is the inferior gluteal artery corresponding to the superior gluteal artery. And last, and certainly not least, is an artery that's going to pass posterior to the sacrotuberous ligament, but then come back in through the inferior sciatic foramen. So it's going to go out the superior sciatic foramen, back in the inferior sciatic foramen, and then loop this direction thereafter. I'm just going to draw this in, but I'm going to have to erase quite a bit of it as we go a little further along. This vessel is the internal pudendal artery. So we have the external pudendal artery over here. I've kind of mauled that a little bit, but external pudendal artery here. The internal pudendal artery came all the way from here to get where it was going. So here, I'm going to start drawing these in. Alright, so once again, we've got coming off the terminal end of the internal iliac artery, the inferior gluteal, the middle rectal, and the internal pudendal artery. Before I go any further and start looking at the different branches that are going to be coming off of the internal pudendal artery, I want to take just a second and draw your attention to this area right here between the obturator artery and these other terminal branches that I've just been mentioning. This little area that I'm outlining in green is where we're going to find the branches that vary between women and men depending on the internal genitalia that are present. So this is where things like the uterine artery or the artery to the prostate gland are going to arise. And because we have 2 different patterns in this area, depending on whether we're looking at a male or a female, we're going to revisit this and draw this later. At the moment, we've got what amounts to a relatively unisex version of the vasculature, and we're going to keep it that way for the time being. We're now going to come down here and follow the branches of the internal pudendal artery and see what those are. Now we have a middle rectal artery here coming off the internal iliac. There's actually a superior rectal that comes off way up high in the abdomen from the inferior mesenteric artery, but we're not going to worry about him. What we're going to worry about now is that below this middle rectal we have an inferior rectal artery coming off the internal pudendal artery. And as its name suggests, it's going to supply the inferior rectum as well as the anal region. Now thereafter, the internal pudendal artery is going to supply blood to the perineum, also sometimes called the pudendum. And this is the area of the anal and genital structures. So first off, we're going to have a branch after the inferior rectal that comes off, we call the perineal artery or the perineal branch. Now it's going to supply several structures in the area, but amongst those, it gives off a very large branch called the posterior scrotal or posterior labial artery. And that's no big surprise, going to either the scrotum or the labia, depending on whether it's a male or female. Also coming off that perineal artery is a branch that's going to some of the erectile tissues of the genitalia. This is the artery to the bulb, and it could be the bulb of the vestibule or the bulb of the penis. It's also known as the corpus spongiosum, but they're both coming off right there. And last, we have some vessels that are coming off the internal pudendal right here. And at this point, we have a little bit of a nomenclature switch. The internal pudendal terminates, and what we're left with at the very end is an artery that goes into the other erectile tissues of the penis or clitoris. This is the deep artery of the penis or clitoris, and the other continuation is going to be the dorsal artery of the penis or clitoris, and that's what we're going to show right here. So I'm going to take a moment, color these in. Inferior portion here of the internal iliac artery gives off the inferior luteal artery, the middle rectal artery, and the internal pudendal artery. Internal pudendal passes out of the pelvis through the greater sciatic foramen, and in doing so it passes posterior to the sacrospinous ligament, but it then immediately re-enters the pelvis through the lesser sciatic or inferior sciatic foramen right here, and is going to travel medially and give off the the inferior rectal artery, the perineal branch, and that amongst other things is going to supply the posterior scrota or labium, so posterior scrotal and labial arteries right there, as well as the bulb of the penis or clitoris through the artery to the bulb. That's right there. Let me finish coloring in. Oops. The rest of that ischium right here. Then continues forward and gives off the deep artery of the penis or clitoris and dorsal artery of the penis or clitoris. Now, in this area, it's often covered by the fascia of the obturator internus muscle, which may extend a bit further down. And in that case, we're going to have a little canal covering the vessel as well as its accompanying nerves that's coming off the fascia of the obturator internus muscle. That is called the pudendal canal, also sometimes known as Alcock's canal. There are some variations in the branching of this area, and it's not uncommon to have differences such as the obturator artery leaving prior to or more proximal to the umbilical, and little variations like that happen relatively frequently. There are a few that are probably more important that you want to be aware of. The first one is that instead of coming off the internal iliac artery, you can sometimes have, pretty regularly, your obturator artery come off the external iliac and head out the obturator foramen in this way. So here is a common variation on the origin of that obturator artery. So we'll draw him in right there. It's not uncommon to actually have both branches present in the area, although usually you have one or the other, either coming off the internal iliac artery and making that whole transit across the medial side of the pelvis, or just running across the superior pubic ramus from the external iliac artery. The other variation that happens relatively regularly is that instead of coming off the internal iliac artery's anterior division, you'll have the inferior gluteal artery arise from a common trunk that also gives off the superior gluteal artery. So here's yet another common variation that occurs in this area. Just be aware that that does happen. Variation is normal, but we still have to have an obturator artery and an inferior gluteal artery, one way or the other, even if they come from relatively strange places. Alright, now we're going to turn our attention to the green box and see what's inside the green box. What is inside are all the arteries that vary from male to female, depending on the internal genitalia that are present. The arteries that I've diagrammed here are a relatively unisex version of things, and now we're going to delve into the differences between the male and female vascular branching. Alright, I have got two green boxes here for us to work with. On this side, we're going to start with the male pattern of the vascular structures, and on this side, female pattern. That's not for any particular reason other than it's a little easier to see in the male because one of the major players in this area is an artery we haven't talked about yet. So coming off our internal iliac artery as it transits through that little green box, just below where we'd have our obturator artery and just above where we'd have the inferior gluteal, middle rectal, and internal pudendal, we have an artery we haven't really talked about. And that's going to be the inferior vesicle. So the superior vesicle came off the umbilical artery and it supplied the superior part of the bladder. It stands to reason we need an artery to supply the inferior portion of the bladder, and that is our inferior vesical artery. In males, it's going to have a branch that goes all the way to the bladder, but along the way it gives off a branch to the ductus deferens, the cord that's carrying spermatozoa from the testes, and it's going to have another branch to an organ at the base of the bladder, that's the prostate. So we'll draw in the prostatic branch right there, and that's it. Alright, so once again, internal iliac arteries, the anterior division gives off the inferior vesical artery, which in turn gives off the artery to the ductus deferens and the artery to the prostate. Now at this point, I typically get some comments in these videos accusing me of not knowing my anatomy because they'll say things like, oh, but you know that the artery to the ductus deferens really comes from higher up. It's really coming from the superior vesical arteries and traveling into the ductus deferens that way. Now here's the thing, I know my anatomy, but what I want you to get is that different sources will say that these arteries come from a variety of parent arteries, and that's because there's individual variation. And yes, absolutely, you can get the ductus deferens blood supply coming from either the inferior vesical artery or coming in from the superior vesical artery right there. So there are variations here. For the purpose of this video, I'm using the pattern that was more or less laid out in Essential Clinical Anatomy by Moore, Agor, and Daly. So that's the version I'm going with. Just be aware different resources and different texts will have different versions of this, sometimes between different editions or even within the same edition between figures and text. So just be aware, variety is the rule of the day with anatomy. Now let's scoot over here and see the same pattern in the female, because we still need to get blood to the inferior aspect of the bladder, but we don't have to worry about the prostate or the ductus deferens. What we do have to worry about is the uterus and the vagina. Now, in addition to the uterus and the vagina, we also have ovaries in women and testes in men. The gonads, ovaries and testes, get their blood supply from way up high in the abdomen, so they're not even close to the branching that we're showing here. Just be aware, they develop way up high and they pull their blood supply down with them off the aorta. Now here, the easy thing about female vascular anatomy is that we have one great big uterine artery that goes to the lateral wall of the uterus and supplies a huge amount of blood to it. Off of that uterine artery, we have the more inferior vaginal artery. And so we've got blood supply to the uterus and the vagina. One thing to know about this blood supply though is that instead of nice discrete little artery right there, when they reach the wall of the organ, these vessels really do branch out all along the lateral wall of the organ, and they anastomose pretty significantly with each other. So we have an anastomotic network running along the wall of those organs, and in fact, as it goes higher up towards the oviduct and ovaries, we'll find anastomoses between the uterine artery and the ovarian artery. So there's a lot of anastomosis going on here. Now, in addition, women still need to have blood going to their inferior bladder. So we need an inferior vesical artery as well. Commonly, that's described as coming from the vaginal artery and passing anteriorly from there, although some sources will say that it's a direct branch of the uterine artery. In my experience, I've seen both, so individual variation is possible in those cases. Alright, so now that we've got that all colored in, off the internal iliac's anterior division in females, we have the main branch, the uterine artery, which gives off the vaginal artery, and these two form a pretty significant anastomotic connection along the lateral wall of the vagina and uterus, all the way up to the oviducts and probably anastomosing with the ovarian arteries branches. Off of the vaginal artery, although sometimes the uterine, we finally have our inferior vesical artery supplying the inferior aspect of the urinary bladder. And that completes our tour through pelvic blood supply. I hope this has been helpful, and have a great day.